Okay, let's talk about something incredibly valuable and super personal, our health data. I mean, this stuff holds the keys to curing diseases, but we have to protect it, right? It's non-negotiable. So the big question is, how do we unlock all that potential while keeping our privacy completely locked down?
And really, this is the heart of the matter. You've got researchers and AI systems that need massive, and I mean massive amounts of data to find the next breakthrough treatment. But on the other hand, our health records, they're just about the most private thing we own. So how on earth do you solve that fundamental conflict?
Well, that brings us right into what you could call the data dilemma. It's this high-stakes balancing act between this amazing promise of medical progress for everyone and, our fundamental right to individual privacy.
Now, this is where it gets really interesting. On one side, you have public health progress. We're talking about speeding up research, building smarter AI, things that will literally save lives. But on the other side, you have individual privacy. And that's about keeping records confidential, protecting our identity, and really, the trust that our entire medical system is built on. These two things seem like they're in a total standoff.
So, what's the bridge between these two worlds? It's a process called de-identification. You can think of it like a digital privacy shield. It's this absolutely critical technique that lets scientists dig into all that valuable medical information without ever knowing who the patient is. This is the key. This is how we solve the dilemma.
So, how does this magic actually happen? Well, the tech behind it has come a long, long way. We've moved from really simple rules to incredibly sophisticated AI that can actually understand the nuances in a doctor's notes.
And the evolution here is just remarkable. I mean, we started with people literally taking a digital black marker and manually redacting names. As you can imagine, that was incredibly slow and, really easy to miss something. Then we got a bit smarter with simple rule-based systems. Things like find and remove any number that looks like a phone number. It was fast, but way too rigid. It couldn't handle any nuance. And that brings us to today, AI that doesn't just see the text, it actually understands the context.
The core technology making this all possible is called Named Entity Recognition, or NER. The best way to think about it is like a super smart highlighter. It automatically zips through a document and tags every name, every date, every address. But here's the crucial part. It gets the context. It knows that Dr. Smith is a person's name that needs to be removed, but Dr. Pepper is just a soda that can stay right where it is. So what's the secret sauce giving NLR these superpowers? It's all driven by these incredible AI models. You've probably heard of some of them, like large language models. These systems are trained on insane amounts of text, so they understand the complex, sometimes messy, and totally unstructured language that doctors use in their notes. And you can even combine them into hybrid systems to get even better accuracy. Okay, theory is great, but let's actually see this thing in action. We're going to take a real, private, clinical note and watch how AI turns it into a safe, usable resource for the public good.
All right, so here's our starting point, a totally typical clinical note. You can see the protected health information, or PHI, clear as day. You've got the patient's name, John Doe, his date of birth, the hospital name. As it stands, there's no way this note can ever leave the hospital's secure server.
So, technique number one, the most basic approach, is just masking or redaction. The AI identifies all that sensitive data, the name, the date, the hospital, and bam, it just blacks it out. It's clean, it's simple, and it gets the job done. The PHI is gone.
But here's the thing, just blacking stuff out can sometimes mess up the structure of the data, which makes it less useful. That's where a much more advanced technique called obfuscation comes in. Instead of just deleting the information, the AI replaces it with a generic placeholder, like name or date. Now, this is the crucial part. The data is totally anonymous, but its original format is perfectly preserved. And that is vital for things like training other AI models or doing really complex research.
And why does this matter? Well, the impact is huge. Just look at where all this safe, de-identified data goes. A massive 45% of it fuels clinical research, which directly helps scientists find new cures. Another 35% is used to train the next generation of medical AI, making our diagnostic tools way smarter. And 20% even goes toward creating AI that helps cut down on paperwork for doctors, giving them more time with us, the patients.
Now this all sounds pretty fantastic, I know, but it's not magic. And this is where we get into the really nuanced part of the story, the balancing act. We have to navigate some very real challenges here.
This chart right here shows the fundamental trade-off. See, the more aggressively you scrub the data to guarantee privacy, the less useful it can actually become for research. For example, if you remove all location data to protect a patient, well, you might just make it impossible for researchers to track a disease outbreak in a specific area. It's this constant push and pull between maximum privacy and maximum scientific value.
And that push and pull leads to these key hurdles. Engineers are always tweaking for better accuracy. There's always this tiny, tiny risk of what's called residual PHI, that one little identifier the AI might have missed. And medical language is just incredibly tricky. A doctor might write a father of 3, which seems harmless, right? But combined with other tiny bits of data, it could potentially become an identifier. It's a seriously complex problem.
And look, this isn't some far-off theoretical tech. For anyone who's curious, these are some of the powerful, real-world software toolkits that data scientists are using every single day to do this work. Frameworks like these are on the front lines making all this privacy-preserving tech a reality across the entire healthcare industry.
And that kind of brings us to a final, big-picture thought. We've seen how AI can build this incredible bridge between privacy and progress. But as these AI systems get even more powerful, you have to wonder, will the very line between what we consider personal data and what can be used for the public good be redrawn entirely? That's something we're all going to need to think about.
And that's all for this explainer. If you found this useful and you want more breakdowns on topics just like this, please take a second to like, comment, and subscribe. It honestly helps us out a ton. And hey, if you're more of a listener, you can always find the audio version of our explainers over on Apple Podcasts. The link for that is right down in the description.
And finally, we really want to hear from you. What complex topic is on your mind? What should we break down next? Drop your ideas in the comments section below. Thanks for watching, and we'll see you in the next one.